Hi, everybody. Um, Instead of putting 50 million posts in my community tab, I just wanted to tell you about something that could potentially happen if you take the antidepressant venlafaxine. Now, I do talk about it sometimes. I think that this is a very important thing for me to talk to you guys about. My content is about ADHD, autism, and neurodivergence, but I also talk a lot about depression. And I had a situation happen where the website said for this pharmacy that they would be open during the holiday weekend. I had a doctor's appointment on Friday where I had to drive an hour to get there. It was a nightmare. I didn't end up having my appointment. It's not related, but it was a mental health day. It took me all night to regulate from that nightmare. But I had no idea what was about to happen. I have diagnosed depression, major depression, I have anxiety, and I have ADHD. I am not for or against medication. I will say that in some cases medication is necessary and it can save lives. However, I did not know how severe the withdrawals would be if I went 3 or 4 days without my medication. I am looking lucid right now. I am on day 4 of not having this medication because I ran out just before Labor Day, Memorial Day weekend. And this particular pharmacy did not post accurate hours on their website. So I took my last pill on Friday. I was bracing myself for a stressful day because this is I have had this ongoing problem with this new prescriber I have. My last one retired. She requires me to drive all the way down there. Since I have moved far away from this place. This is actually farther away than the place I was going. The prescribers that were there all left. And so, thousands of patients have now had to go to this other location, which is even farther away from where I live now. And because I have the controversial Mass Health I can't think straight. It was on the news and everything. It's changed news, but nobody will fucking take my insurance, so I can't get a new prescriber close to me. Turns out that this medication I take has a very short half-life. This is bad. Now, I'm not mad at them for discussing that I take this because this has saved me. This has been very beneficial in my life. However, I did not know the crisis that can come. When I'm feeling better, I will do a long video let's just say I can't walk without getting dizzy. I might start bawling. I might start yelling at somebody. Now, some of this sounds like classic withdrawals. But in this case, it's severe. When you have, look up venlafaxine. It's an SNRI. So it's like an SSRI for serotonin, but it also does norepinephrine, which is fine. I have taken other medications in the past and forgotten my medication. As bad of a day you might have, it's not that bad. Because it takes a long time to build up in your system. And if I've ever forgotten to take my bupropion, or previously before I've taken this one, the other SSRI was citalopram, I didn't get bad symptoms right away. It would take a few days. This one, I don't want to scare you. There's like very short half-life. So, unlike all of the other medications that slowly build up in your system, and then if you stop, slowly get metabolized out and are still kind of floating around doing a job, this shit, within a matter of hours, has completely been flushed out of your system. So, when I've been learning about this the last few days, when I'm not crying, when I'm not in fucking pain, I am so upset about this. This is like a medical crisis where technically I should be going to the ER. But I have been sedating myself so that I don't have the scary blood pressure thing. Incidentally, that risk happens to be because of the combination of medications I take. It may not be for you. I cannot stand. It's bullshit. It's bullshit. It's so bullshit. The rebound is so immediate. It's fucked up. I don't want to say don't take this. I'm on tomorrow's day 4. You're not supposed to go more than a day without this. You are not supposed to stop taking your antidepressants ever. I already know that. But because this is severe with the way it flushes out of your system, this is bad. Please, if you take venlafaxine, do what you need to do to look up when you need to fill it next month and write it in your schedule. Make it like it's a doctor's appointment. A few days before it runs out, however early they let you do it. You write that in your fucking calendar like it's a doctor's appointment. Don't you dare miss, and look for these weekends. I have had to be sleeping most of today and yesterday. I have not gotten the throwing up. I am so grateful. And I have not gotten these electric shock brain zaps yet. But my body typically metabolizes this slower than other people. So for me, I don't tend to get bad symptoms until the next day after I missed my first dose. And on tomorrow's day 4, I can't even drive. If you end up in this situation, do not drive yourself to the pharmacy. If you get up and you're having vertigo, be careful to even take a shower. I had such a hard time even walking to my kitchen this morning. and I was walking really slow. And when I got to my kitchen, I had to grab onto the cabinet frame so I wouldn't fall. And then when Curtis came and I was like holding on so tight. And he asked me something and I just started yelling at him and I just started bawling my eyes out. My head hurts. I feel like I'm in a fishbowl. And if this happens to you because of the blood pressure thing and your head hurts, take Tylenol. Drink lots of water. If you suffer from suicidal ideation or self-harm, make sure, if you're ever in this situation, that you have people around you to keep you safe. This is very important for me to talk to you guys about today. I am very fortunate that I had somebody pass away in my family when I was very young. So that's formed who I am, and anytime I've even gotten close to having those kind of scary thoughts, I go for help. So I have that protection that I am very grateful. But other people may not be so safe. So if you take a medication like this, and before you took a medication like this, you were struggling with that, you're not only going to have these awful withdrawal symptoms, you're going to have to deal with the rebound, especially if you've been taking it for a long time. I just found out you're not supposed to take it more than 6 months, and she's had me on this fucking medication for 2 years. And I found out it reduces the gray matter in your brain. I am so symptomatic from this withdrawal. I can't think straight. So, be responsible. I'm getting this medication tomorrow. I'm here with my family. I'm safe. I've given them the list of things to look out for. If I'm getting dizzy, I ask someone to help me if I have to walk. Do not drive yourself to the pharmacy. I have a friend coming over who's going to take me because I can't fucking drive. This is not how I wanted to spend my weekend. Now, I am older. I have nursing student experience. I think in those clinical ways. I've already looked up things that I can do to be proactive to keep me safe. And I have been using all of my skills that they teach us being neurodivergent to stay calm. But mostly, I've been trying to sleep. Because the longer I stay asleep, the more I don't have to deal with this. Now, I don't want to say, like, don't feel bad for me, but it's bullshit. This should not happen. To me, this is very scary. If you have a patient who has executive functioning issues, poor working memory, and has a fucked up sense of time. So maybe you filled your script a month ago, but it feels like a few days ago to you because your sense of time is fucked up because your brain's wired different and it doesn't work right. Even with all, no matter how careful I am and all the different strategies I use to remember, there's eventually going to be a time that I mess up and I don't feel it. So, antidepressant withdrawal syndrome, antidepressant discontinuation syndrome. For those of you who think, I'm fine, I'm just going to stop, I don't want to take these anymore, these are so bad for me, do not fucking do that. I love you. Okay? care about yourself, know that you feel fine because it's working. These are not evil, but just because something is prescribed to you does not necessarily mean it does not have risks. It is very, very, very important for doctors to educate patients. And my prescriber never educated me about this. And I'm fucking bullshit. This is dangerous for people. I'm continuing to take my other medications. I haven't had coffee. This is really bad for your brain. Really bad. I will update you guys. I sound normal. I sound lucid. I'll only be like this for a little while. I am sorry if you were having a good holiday weekend and you saw this. I just want other people to be aware so they don't up and stop taking your medications. If you take antidepressants, if you take antipsychotics, if you take these medications, they are powerful. They have side effects. They can be really bad for you to just stop. Some people have negative side effects from, unlike other medications that have withdrawals for a few weeks. Antidepressants can have horrible withdrawal symptoms, sometimes for people for years. So you need to make sure, if you take these and you decide to stop, you tell your doctor, I'm going to stop, with or without you, however you want to tell them, so that, you know, if you think they're going to talk you out of it and you've already made up your mind, tell them. That way at least you can taper off slowly. Okay? Your brain has adjusted to this medication. It's doing its job. So depending on the type of antidepressants, maybe your brain has trimmed away some of those receptors. It's trying to reach homeostasis. It's adjusted. You take that medication that's doing that job away, and your brain's going to work even worse than it did before you ever went on it. So whatever you were dealing with, whatever depression you had, however bad it was, you go ahead and double that and know that that's what you're in for. And you don't want that. We need you. You are supposed to be here. This is part of care. It sucks. It sucks. It sucks. But your health and well-being is important. Don't quit your medicine. And do what you can to come up with some strategies that don't end up in the situation I ended up in. I love you guys. I'll see you later. Bye.